Yeah, hello. Thank you very much for joining this IAFM conference. Namaste, good morning. Indian Association of Functional Medicine is committed to do education, do awareness of functional medicine and various chronic disease. In this conference, we'll specifically focus on a strategy, how we can early diagnose, how we can prevent, and how we can work on a cancer. Let me start giving you some examples and some statistic on a cancer. Let me just show you my screen. So I will just make you aware about where we are now. So in India, as we know, after COVID, there is sharp rise of all kind of cancer. So in IFM, we are organizing this event every yearly, and this year, as we discussed that we want to prevent the cancer. So let's talk about the burden of cancer. You see, in 2021, we have 26.7 million patients who are suffering with cancer, and next year this figure going to increase, and it could be a 29.29 millions. And you can see that a sharp rise by 12.8% next year. And you can see the leading site of cancer in a male could be a lung, and in female we see a sharp rise of breast cancer and cervical cancer, and even all other cancer they are rise. So I just want to make you aware about that we are dealing with some kind of rise of chronic cancer burden. Now, if you look at the conventional medicine, we are doing the base thing. We have base therapy, we have base surgeon, we have chemotherapy and radiotherapy. But if you look at the statistic, then what we are doing in a treatment of cancer is not enough. And the conventional medicine approach is a one part of the tree of a puzzle, but we have to think beyond that puzzle. So I want you to invite to think differently, as we are agree that something is there that we don't know. And if we want to work on management and prevention of cancer, then we have to think differently. And today in this conference and tomorrow this conference, speaker will come and make you paradigm shift our thinking, that you can think differently how we can prevent and manage the cancer. I want you to invite to think about this question. What is the most common question we fail to answer to all the chronic condition, including the cancer, because cancer is not a different part. So let me just brief you aware about what is functional medicine, and that is the important question we forget to ask. And that is how my patient developed the cancer. And if you look at the philosophy of functional medicine, then I will say functional medicine is not an alternate science. It's a foundation science where we think differently, and we need to answer this question: how the cancer developed. Let me show you how the cancer is developing. We all know that there is some kind of genetic background. So patient have some kind of genetic history or family history, and we know that genes are playing a role. But I want you to make aware that genes are not our final destiny. That's the environment they play a role. And usually most patients they encounter with some kind of trigger in their life. That trigger can be an infection or trauma, can be some kind of toxic exposure, or maybe that ongoing lifestyle changes, and then patient have a bad lifestyle choices. Either they have a nutritional deficiency or they may be having a constant state. But because of this environmental exposure, we can say environment, or we can say this environmental exposure can then increase their toxins, chronic infection. It could be a mental and emotional stress, and same time they have some kind of nutritional deficiency or the lack of sleep, or we can say a deficiency of healthy lifestyle. And because of this all environmental changes, they start having some kind of system dysfunction. And this system dysfunction can be leads to multiple system dysfunction. And when you look at the cancer patient, they doesn't only have a cancer, because they might be having some other symptom and other things over there. And let me just show you at cellular process how most cancer will develop. If you forget about the genetic and congenital cancer, then most cancer usually take an 8, 10, 20 years to develop. And this is a cellular process that is happening in a cancer development. Now look at normal cells. And as I mentioned, the epigenetics or environmental factor, that the toxins, chronic infection, mental, emotional stress, and lack of all the nutrition and healthy lifestyle, the patients start having some kind of cell, they become abnormally behaved, and that abnormal cell, in a science we can say them as a dysplasia. And this dysplastic cell is not recognized by your immune system, because immune system is designed to destroy this kind of cells, but because immune system cannot recognize, because primary instinct of our human cells or any living organism is to survive. The same thing is applied over here, and because of that instinct, they want to survive, and immune system cannot recognize these cells, and then this abnormal dysplastic cell, they start and becoming a tumor cell. But you can see this is all the process is usually taken 8 to 10 years to develop, and then finally immune system cannot destroy these cells, and then tumor cell become a cancer tissue. And what we see in our radiograph, or where we see clinically as a tumor, but you can see this is how the cancer develops. So here the important message is that functional medicine can address this kind of root cause, and functional medicine is a tool that provides to connect the dot from the conventional medicine to the Ayurvedic science and all science of lifestyle. So I will say that functional medicine is not an alternate science, it's a foundation science, and it's based on biology. And we want to find out the root cause. We want to peel the onion to find out what is the root behind this one. And then if you go upstream and if you can treat the root cause, you can prevent the cancer, or even you can treat the cancer. Now, I would like you to invite, and I would like to connect the dots where you can see the root cause. Now, in functional medicine, we talk more about the root cause. So I just want you to brief about what kind of dots you can connect in this conference. Now, if you look at this whole things, then every patient doesn't have all the abnormality or all the dysfunction. But I just want to invite you to think about the patient who is suffering with the cancer. They might be having some issue with their gut dysfunction. So in this conference, you will see Dr. Ruhi and Dr. Ramesh. Gaurang Ramesh will talk about the gut and how we can balance the gut, how we can find out some factor that are affecting the cancer, like an hypochlorhydria, or patient might be having an acid blocker, or they may be having some dysbiosis. So you will learn more about the gut and relation of gut function with and cancer. So that we're going to talk about in this conference. You can see the immune system is affected in the cancer, and immune dysfunction is one of the root mechanisms that leads to the progression of a cancer. And you can see that. So in this conference, we will lot heard about how vaccine can interfere, or what kind of strategy you can apply in a vaccine. So we have a panel discussion on a vaccine. Then you can see that Dr. Ashwini will talk about what is the advanced thing we can, and what is the advanced peptide management we can do to modify the immune function and immune system, how we can resilience immune system that can deal with this kind of cancer. And you can learn more about the immune system with a different speaker. And if you look at the cancer patient, and always they complain about the low energy and fatigue they are talking about. So when you think about this kind of symptoms, you start thinking, why my patient having a low energy? So you can look at the mitochondrial dysfunction. Now, mitochondria is very important in a human cells and human life. And if you know that each and every human cell or animal cell, they contain almost 700 to 800 mitochondria. So mitochondrial energy metabolism, glucose metabolism, you can see that patient is suffering with pre-diabetes or diabetes before even they start the cancer. So there is a direct or the connection with your metabolic functions and the cancer. So Dr. Preeti will talk about this correlation with a metabolic, and she will talk about the ketogenic diet, how you can change your dietary changes. So I just want you to aware about, you can connect the dots over here, that energy metabolism is affected in your cancer patients. Then you can see we have a major function in our body that's called a detoxification function. and I will talk about the methylation, and we know that estrogen is playing a major role in development of breast and cervical cancer. Now we have to think beyond that part and how we can find out the estrogen dominance and what we can think about estrogen dominance and how we can look at the system physiology and how we can modify the expression of genes or with a methylation, and we can teach you about what is the role of methylation, and that's playing a role in estrogen metabolism. Then we have a whole functions of transport. You can see many patients having a dyslipidemia or endothelial dysfunction, or they may be having an affection of thyroid. So how our body transport molecules from one organ to other organs, that's the transport mechanism we have in our system. And then you can see we have a neuroendocrine system. Dr. Thomas Lowry will talk about communication hormones. Dr. Kadambi is there. Dr. Shikha will tell you about the communication hormones. Dr. Anjali Huda, she will talk about the progesterone and hormones. So you can see connection of all the hormones within development of cancer. And then finally, we have structural integrity. If your gut issues and if your intestinal permeability is increased, that's going to affect the whole inflammatory mechanism. So I just want you to aware about there is an interconnection with all the functions in the human, in our body. And that's the science, and that science we call collectively as a functional medicine. And the most important part of functional medicine is your lifestyle factor. We call them modifiable lifestyle factors. And you can see sleep and relaxation. So many of speakers, they will talk about the sleep and how you can work on a sleep, how you can work on energy medicines, and how you can heal yourself. Many speakers will talk about the importance of movement, what the strategy you're going to apply, how you can move your body, how you can increase the exercise, what is importance on that one. And then whole Dr. will talk in this conference about the importance of nutrition. As today's world, we are having too much food over there, but the food is deficient in primary nutrition. Many patients you see a deficiency of vitamin D and all stuff. So nutrition is very important part of our human cells. And if you look at the basic science, then we have an exposure of toxins, we can say a carcinogens, and then the same time we have a lack of nutrition to deal with this kind of toxins. And that's the basic things that makes the system dysfunction, and then you start having an abnormality in our functions. And then the stress we heard will not just teach you a theory. So we have a practical session, how you can work on a stress. We teach you about the meditations, and you will learn a lot in a second day, where we're going to give you experience how we can work on anxiety, stress, and meditation. But that's a very important part. And then finally, you can see there is a relationship, how we relate to other humans, how we relate to our family, how we relate to our colleague. And you can see a central part of matrix, that is a mental, emotional, and spiritual. And we don't deny the emotional trauma on a development of a cancer or any chronic condition. If you're stuck in any kind of emotion, like say a grief, or you can stuck in a guilt, or you can stuck in some kind of chronic emotional burden. So that is also the part. So now you can look at the whole matrix, then you can connect the dot. So if you want to prevent, then you can work on a function. So identify the root cause, where my patient or where my family member is suffering, what the dysfunction they have, and then depending upon that dysfunction, you start correcting the function. So I just want you to think differently and find out. And let me ask you a simple question, that if you work on a gut function, and if gut function improves, do you have improvement in your prevention strategy? Do you have improvement in your management of cancer? Let's say if you modify your immune function, definitely when you will get improvement in the management, or you can the strategy to prevent the cancer. And same way you can work on hormones, you can work on a detoxification pathway, you can work on energy, and the whole matrix. If you can work on this kind of functions with modifiable lifestyle personal factor, then definitely you can have improvement in your preventive strategy, and of course you have an improvement in your management of a cancer. So in this conference you're going to hear a lot about this kind of connection, but keep these things in your mind, and then you can see all the lectures and all the speakers, they will talk about all the different functions of the human body, and then you can get something that you can apply on your patients, you can apply on your things. Thank you very much for joining this conference, and I would like you to learn more in this conference, and that's how we can go about. Thank you very much once again for joining this conference, and let's deep dive in prevention of cancer through a functional medicine lens. Thank you very much once again.